Gentlemen, the way you're sleeping right now might be choking your prostate. And I don't mean that metaphorically. I mean physically compressing it, night after night, making it swell larger, pushing harder against your bladder, and forcing you out of bed 3, for sometimes 6 times a night. Most men think an enlarged prostate is just bad luck or old age, something you accept and learn to live with. But what if I told you that simply changing your sleep position, something you're going to do tonight anyway, could reduce prostate swelling by up to 40% in as little as 4 weeks? No pills or procedures. No expensive supplements. Just physics, circulation, and one adjustment that takes 0 effort once you know what you're doing. By the time we're done here, you'll know exactly which position works, why it works, and how one 68-year-old man went from waking up 5 times a night to sleeping straight through until morning, just by repositioning his body. Now, the worst position for your prostate? Sleeping on your stomach. When you lie face down, your pelvis tilts forward, your lower abdomen presses into the mattress, and your prostate, which sits right behind your pubic bone, gets compressed for 6, 7, 8 hours straight. That compression restricts blood flow. And when blood flow drops, inflammation rises. Your prostate swells. You wake up needing to urinate. Your stream weakens. And over months and years, that nightly compression can make an already enlarged prostate even worse, like squeezing a sponge and never letting it fully expand. But here's what almost no one talks about. It's not just stomach sleeping. Even side sleeping, which most men assume is perfectly safe, can create serious problems if you're doing it wrong. In fact, there's one side of your body that's actively making your prostate symptoms worse every single night, and I'll explain exactly why in just a moment. My name is Dr. Mei Anderson. I've been a men's health specialist for over 25 years, and I know what you're thinking. Why should I listen to a woman about men's problems? Fair question. Here's my answer. I've sat across from thousands of men in their 60s, 70s, and 80s who were too embarrassed to tell their regular doctors what they were really experiencing. The midnight bathroom trips that leave you exhausted. The weak stream that makes you stand there twice as long. The fear that intimacy with your partner is over. The frustration of feeling like your body has betrayed you when you're still mentally sharp and capable. I may not live in a man's body, but I've spent a quarter century listening, learning, and finding solutions that actually work. Not pharmaceutical band-aids that come with side effects you don't want, but natural, evidence-based strategies that respect how your body actually functions. And what I'm about to share isn't theory pulled from a textbook. It came from watching patient after patient transform their prostate health by fixing something so simple. Most doctors never even mention it during appointments. Because let's be honest about what's really happening when your prostate enlarges. Yes, the bathroom trips are exhausting. Yes, the weak stream is frustrating. But here's what most men don't realize. Chronic nighttime urination destroys your sleep quality in ways that go far beyond just feeling tired. Poor sleep crashes your testosterone levels, weakens your immune system, and increases your risk of heart disease, diabetes, even cognitive decline and dementia. There's a reason sleep deprivation is used as a torture method. Your body needs deep, uninterrupted sleep to repair tissue, restore hormone balance, and keep your brain functioning at its best. When you're waking up multiple times every night, you never reach the deep sleep stages where testosterone is produced and growth hormone is released. You're essentially aging faster than you should be, and your prostate is the trigger pulling you out of the restorative sleep your body desperately needs. And here's the part that hurts the most, the part men don't always want to admit. When you can't sleep through the night, your partner can't either. I've had wives tell me, I hear him get up, and even though I try to stay asleep, I can't. We're both exhausted all the time. That exhaustion breeds irritability, creates distance, and builds resentment neither of you intended. What starts as a prostate issue becomes a relationship issue. Your energy drops. Your mood suffers. Your intimacy fades. And that's why this matters so much. It's not just about you getting up to urinate. It's about the quality of life you're trying to maintain, and the relationship you're trying to protect. Let me introduce you to Vernon. He came to my office at 68, completely exhausted and defeated. He told me, Doc, I'm waking up 5 times a night. My wife moved to the guest bedroom because I kept disturbing her sleep. I'm taking naps in my car during lunch just to function at work. I tried saw palmetto. I tried cutting out fluids after 6 in the evening. I even got a prescription for Flomax, but the side effects made me dizzy and completely killed my sex drive. I feel like I'm choosing between urinating properly and being a husband. When I went through Vernon's medical history and daily habits, something stood out immediately. He'd been a stomach sleeper his entire life. And when he couldn't sleep on his stomach anymore due to lower back pain that developed in his early 60s, he switched to sleeping on his right side, which, as it turns out, was actually making his prostate symptoms worse, not better. His prostate wasn't just enlarged from age and hormones. It was being mechanically compressed every single night for 8 hours straight, like that sponge I mentioned earlier. Squeezed tight with no chance to expand and drain properly. I told Vernon, we're going to change one thing starting tonight. Just one. Your sleep position. And I want you to track your bathroom trips every night for the next 4 weeks. He looked at me with complete skepticism. He'd tried medications. He'd tried supplements. He'd tried every internet remedy he could find. Why would something as simple as sleep position make any difference? But he was desperate enough to try anything, so he agreed. Here's what's happening inside your body while you sleep, and why position matters more than you've been told. Your prostate sits in your pelvis, surrounded by a network of blood vessels, nerves, and lymphatic channels. When blood flows freely through those vessels, your prostate stays healthy. When circulation is restricted for hours at a time, inflammation builds up. Think of it like a garden hose. When you kink the hose, pressure builds up behind the kink, and water can't flow properly. That's your prostate when it's compressed against bone or squeezed by the weight of your internal organs. Now, when you sleep on your stomach, your pelvis tilts forward, and your body weight presses your prostate directly against your pubic bone for the entire night. Blood flow decreases. Lymphatic drainage slows down. And inflammation accumulates overnight, which is why you wake up with that urgent need to urinate, even though you didn't drink anything for hours before bed. But here's the mistake most men make, the one Vernon was making, sleeping on their right side. And this is where anatomy becomes critically important. When you lie on your right side, gravity pulls your internal organs, including your liver, which is your body's largest organ weighing about 3 pounds, directly toward your prostate. That extra pressure restricts circulation to your entire pelvic region. A study published in 2019 in the Journal of Urology found that men who predominantly slept on their right side had 30% higher prostate inflammation markers compared to men who slept on their left. 30%. That's a massive difference just from which side of your body is touching the mattress. So why does the left side work better? Because your liver sits on the right side of your abdomen. When you sleep on your left side, gravity pulls your liver away from your prostate instead of pressing it down onto your prostate. Blood flows more freely through your pelvic vessels. Lymphatic drainage improves, which helps reduce swelling naturally. Your prostate gets the oxygen and nutrients it needs to function properly and reduce inflammation overnight. It's not magic, and it's not some miracle cure. It's just basic physics and human anatomy working in your favor instead of against you. And when you combine left side sleeping with a few other simple adjustments, the results can be dramatic. Here's the complete protocol I gave Vernon, and what I recommend to every man over 60 who's struggling with prostate issues and nighttime urination. First, sleep on your left side. Not your back, not your stomach, and especially not your right side. Left side every single night. If you're not used to side sleeping, it might feel awkward or uncomfortable for the first few nights while your body adjusts, but most men adapt within a week. Second, place a pillow between your knees. This keeps your hips properly aligned and prevents your top leg from pulling your pelvis out of neutral position. When your pelvis stays neutral and balanced, your prostate stays decompressed. You don't need anything special. A standard bed pillow works perfectly fine. Third, elevate your upper body slightly, about 15 to 20 degrees. If you have an adjustable bed, this is easy. Just raise the head section. If you don't have an adjustable bed, use an extra pillow under your upper back and shoulders, not just under your head. This slight elevation helps drain lymphatic fluid from your pelvis throughout the night, reducing swelling even further. Fourth, and this is a technique most men have never heard of, Empty your bladder completely before bed using what's called double voiding. Here's how it works. Urinate normally, standing at the toilet. Then wait about 30 seconds. Don't leave the bathroom yet. After 30 seconds, try to urinate again. You'll be surprised how much more comes out, sometimes a significant amount. This double voiding technique reduces the total volume your bladder has to manage overnight, which gives you a longer stretch before that first wake-up call. And fifth, give this protocol a full 4 weeks of consistency. Your body needs time to adjust to the new position, and it takes time for chronic inflammation to decrease. Most men notice some improvement within 7 to 10 days. Fewer bathroom trips, a stronger morning stream, better energy during the day. But that full 40% reduction in prostate swelling and inflammation? That takes about a month of consistent left side sleeping combined with these other techniques. Now I know what you're thinking. What if I roll over in my sleep? What if I wake up on my back or my right side? That's completely normal. Your body naturally shifts positions throughout the night, and you can't control what happens when you're unconscious. The goal isn't perfection. It's spending the majority of your sleep time on your left side. Start on your left. When you wake up during the night to use the bathroom, return to your left side. Even if you shift positions while you're asleep, you're still getting significant benefit from those hours spent in the optimal position. Remember Vernon? After 4 weeks on this exact protocol, he came back to my office with an expression I hadn't seen on his face during that first appointment. He was smiling. He said, "Doc, the first week I was still waking up about 4 times a night, so I thought maybe this wasn't going to work. But by the end of week 2, it dropped to 3 times. By week 3, I was down to twice. And last night, I slept straight through until 5:30 in the morning. I haven't done that in 5 years." But here's what really got to me emotionally. Vernon told me his wife moved back into their bedroom. She told him, "I can hear you breathing peacefully now instead of tossing and turning all night. It's like I have my husband back." His daytime energy improved dramatically. His mood lifted. His confidence returned. And yes, his intimacy with his wife came back too, because he finally had the energy and the confidence and the feeling of normalcy he'd been missing. Vernon's prostate didn't physically shrink overnight. That's not how biology works. But the chronic inflammation from mechanical compression? That reduced significantly within a month, just from changing his sleep position and following this protocol. 6 months later, Vernon told me something I'll never forget. "I don't even think about my prostate anymore. I just live my life." And that's the goal, gentlemen. Not to obsess over your prostate every single day, but to fix the underlying problem so you can forget about it and focus on actually living. Vernon isn't unique or special. I've had dozens of men tell me, "My prostate symptoms improved more from this sleep position change than from 6 months of taking medication." One of my patients who was 72 years old told me, "I was literally about to schedule a TURP procedure. You know, that surgical procedure where they remove part of the prostate, but I decided to try this first. I'm so glad I did, because now I don't need the surgery at all." Here's the reality. Every single night you sleep in a position that compresses your prostate, you're adding to the problem, making the inflammation worse, extending your suffering. But every night you sleep on your left side with proper positioning, you're helping your body heal naturally. The choice is yours, but I'll tell you this from 25 years of clinical experience. The men who take action tonight are the men who see real results within 2 weeks. The men who say, "I'll try this eventually or maybe next week," they stay stuck in the same cycle of frustration and exhaustion. And if you're thinking right now, "I'll get around to this when I have time," remember this. Your prostate doesn't care about your schedule or your intentions. It's either getting worse or it's getting better. There is no neutral. There is no pause button. Every night is either helping or hurting. Now, if you're serious about protecting your prostate health, and I mean truly committed, not just casually interested, then you need to subscribe to this channel right now, because here's what most men don't know and what your doctor probably hasn't told you. There are 3 extremely common habits you're likely doing every single day that are enlarging your prostate faster than anything else. Things your doctor might even call heart healthy or good for you, but are actually inflammatory for your prostate specifically. I'm going to expose those 3 habits in my next video, And if you're not subscribed, you're going to miss it. And trust me on this. If you're making even one of these mistakes, fixing your sleep position alone won't be enough. You'll keep fighting an uphill battle, while these daily habits undermine everything you're trying to fix. So click that subscribe button right now, because the men who follow this channel consistently are the men who stay ahead of prostate problems instead of reacting to them when they become crises. And before you click away, do me one favor. Actually, do a friend or family member a favor. Hit that like button and share this video with another man who needs to hear this information. Maybe it's a buddy who's up 3 times every night. Maybe it's your brother who's too embarrassed to bring it up with his doctor. Maybe it's someone in your golf group who jokes about bathroom breaks, but you know he's actually suffering in silence. Here's why this matters so much. Most men will never actively search for help with prostate issues. They'll suffer quietly and privately until it becomes a serious medical crisis. But if you send them this video, you're giving them a real solution without them having to admit they need help. You might literally change someone's quality of life tonight, and all it takes is one click to share. Do it, because the men who need this information the most are the least likely to go looking for it themselves. Remember, gentlemen, your prostate health isn't about luck or genetics or just accepting what comes with age. It's about strategy. It's about giving your body what it needs to function properly. And tonight, you have a strategy that costs you absolutely nothing, requires 0 pills or prescriptions, and works with your body's natural healing ability instead of fighting against it. Left side. Pillow between your knees. Slight elevation. For weeks of consistency. That's all it takes to see if this works for you. But like I said earlier, sleep position is only one piece of the puzzle. In my next video, I'm revealing the 3 so-called healthy foods and habits that are inflaming your prostate right now. Things you've been told are good for you by mainstream health advice, but are actually triggering swelling and urinary problems specifically in men over 60. When you see that list, you'll understand why so many men feel like they're doing everything right but still can't get relief. So make sure you're subscribed to this channel, because you don't want to miss that video. I'm Dr. Mei Anderson, and I'll see you in the next one. Now go change your sleep position tonight. Your prostate will thank you, your partner will thank you, and 6 weeks from now, you'll thank yourself.